Alright, I'm gonna do this video. I'm gonna talk for a minute and hopefully not talk like forever. Huh?
Will I be too loud?
Probably.
Alright, I'll wait.
Okay. So, a little out of practice on this. I gotta remember where to look so I don't look like I'm looking past you. So it's been a very long time since we've put out a video. Sorry you're not seeing my goats or chickens or my garden that is actually flourishing, despite the fact that I haven't done anything to it. But we're just sitting here at the table. I'm about to have my post-op appointment. And the girls are doing school. Say hi.
Hello, camera.
Hello. Ella's
Hello,
over there
peoples.
doing her herbs. And then my other daughter, I don't know where she is. She was outside.
Upstairs.
She's
In
upstairs.
school.
And she's finished her school.
Oh, I guess
She's probably drawing or playing with Joe.
Okay, so that's
Sit,
what she's
my
doing. So the reason that there were no videos is because I had no energy. I finished up chemo, my last chemo on October 21st, and I was really, really excited. And you know, if you follow me on Instagram, then you know that. But I was super excited about it, and I was gonna give myself a nice week, maybe even 2 weeks, because surgery was gonna be 4 weeks later. And so I was just like, okay, you know, no biggie, we'll get through this week's
Just
symptoms.
rest.
Yep. And then about a day after my week out from my last chemo, I was still feeling really bad. Like I felt like I had the bone pains, which bone pains feel like fever, kind of like you have a whole body fever, but like deeper in your skin. And I had started developing a cough, which is something that can happen with chemo. And so I was just like, well, whatever. And then it kind of went on again for, you know, like 2 more days. And I'm like, okay, something may be off here. So I didn't take any of my pain meds, which is just Tylenol. So I didn't take any pain meds that day. And I took my fever or temperature, and I'm like, there's no fever, I'm okay. So but I messaged my doctor to let him know that I had a cough, because it was one of those things that says if you have a cough, let your care team know. And so I did. And he was like, okay, let's just keep an eye on it. And so then I went in and I said, but I don't have a fever. I feel fine. And then a few hours later, like things started feeling weird. And sure enough, I had a fever. And so I contacted him and let him know that I had a fever. And so he brought me in to take a COVID test, because they have to take a COVID test before they can do anything. And that was negative, which I wasn't surprised. And then the weekend I started feeling a little bit better. In hindsight, I think I started feeling better because my chemo side effects were going away. The water retention was starting to leave. The bloating was going away. Not being on a steroid was kind of like getting out of my system, and that was really nice. And so I didn't feel as exhausted. And so I'm like, okay, maybe it was just a cold, no big deal, that's fine. And then Monday hit and I felt horrible. I still had a fever. I'm like, what is going on? My fever never got super high. It got to like 101.1, and that was the highest it ever got. And so I waited, and then Tuesday I still felt bad, so I contacted the doctor again, and he's like, okay. Well, they also ruled out pneumonia, just so you know, they ruled out pneumonia because I had that cough. The coughing was getting worse, but it's just a cough and a headache and fever, and I think the headache was from the fever, and so again I had to take another COVID test, which is so not fun. And a flu test. I knew it wasn't the flu. I've had the flu. I wouldn't have survived the flu, to be completely honest. I would have either had to been hospitalized or I would have died, like just flat out, being honest there. And because this whatever I had knocked me on my tail. And but my COVID test came back negative again. So no COVID, so nobody had to worry, even though like everybody was worried. Flu was negative, which we knew. So I let my doctor know, and so he called in an antibiotic for me. And within a couple of days, the antibiotic started, like my ears started draining, my nose, like all of this mucus was coming out of it. And when I was coughing up mucus. So I didn't feel stopped up at all. So whatever was blocked got unblocked. So there was some sort of an infection, obviously. And but what I was worried about, because they were already talking about pushing my surgery back a week, and it's not horrible. Like, you want to be top notch going into surgery, or as good as you can going into surgery. I didn't want to cough going into surgery. That would have been horrible post surgery. But I started feeling better. Just shy of shy of a week out from my surgery, I stopped running a fever. So I was essentially like laying on the couch for 2 weeks straight with this infection. And the way that I felt with this infection, because my body was so depleted from 5.5 months of chemo, was worse than any of the chemo I've gone through. That was how bad it was. But the goal was to stay out of the hospital. So I took care of myself. The girls took care of me. Made sure that I had plenty of fluids. Ella made teas for me that really helped a lot. And had a lot of bone broth, things like that, just to keep me healthy, because the goal was to stay out of the hospital. And I achieved that. They did not push my surgery back. So I was concerned about my cough. But about 2 days before surgery, my cough went away. So that was good. And I haven't had a cough since post-surgery. But I had surgery on November 18th. And as I've stated before, I had a single mastectomy. So they just removed the left breast. And there's no reconstruction. That was the plan going in. I don't want reconstruction. It's always an option maybe later, but if you saw my scar, you'd probably be like, yeah, I don't think Sarah's gonna ever have reconstruction there. I don't ever plan on having reconstruction. I don't want it. It's not important to me. And so that was the goal plan going into surgery. For the most part, for me, surgery was easy. I was knocked out the whole time. Prepping for the surgery wasn't super great. They gave me a nerve block. One was a quick nerve block, and one was a slow release nerve block. Getting those were kind of awkward, but the nurses were super sweet. The anesthesiologist was amazing, and probably one of the nicest ones I've ever had. And so I have surgery, and they get me out of there within an hour of surgery. Surgery did take longer than normal. It was supposed to be 2.5 hours. Mine took 3.5 hours. I'll go over why in just a little bit. Yeah, they got me out of there within an hour to come home to minimize my risk of infection, especially with all the COVID stuff going around. And so I barely remember much of that day. I have story after story of the few things that I remember post surgery. Fun little thing is one of my friends, her aunt was the nurse that took care of me after surgery, which was kind of cool to make that connection later on in my very doped up state. So that evening is kind of a wash. I could use the bathroom by myself, things like that. The next day I got up at the same time, and just so you know, I made a goal for myself to kind of keep the same routine from the very beginning of all of this. I wake up at 6 o'clock in the morning. I used to wake up at 5, so I gave myself an hour. But I wake up at 6 o'clock in the morning and take care of the animals and drink my coffee. And that's been my same routine through this whole time. But the next day I could move around on my own just fine. I slept fine. They gave me Tylenol for pain meds. Now I still had the nerve block in, so that pain is going to be minimized. And so I had the nerve block, I had Tylenol for pain, and I had a muscle relaxer, and they told me to make sure I stayed on top of it. So I stayed on top of it. And they said, they knew I have a high pain tolerance, and to not be try to be superwoman in this. I quickly learned not to do that in my first little bit of chemo. So I stayed on top of my pain meds and my muscle relaxer, taking them when I could take them, just so that way the pain would be minimized, because I had no idea what to expect. I was kind of amazed that I could move my arm, and I could move my hand like this just fine. And I had no surgery on here, so I have full range of motion of this arm, which is really nice for my mental health. I don't do well being served by others or having other people take care of me or relying on other people to do things for me. So if I had a double, I would have needed someone to help me use the bathroom. I would have needed someone to help bathe me, all of those things. And while, I have my husband to help me with those things, I don't want to do that. And for my mental health, to just only have one side of my body that was that I couldn't use, but being able to use my dominant side of the body, it helped significantly from this recovery process for me. So I had a lot. Post-surgery was way better than I imagined it would be. I had more energy. I could move around the house mostly just fine. I would have lightheaded moments every now and then, but that's to be expected after a major surgery. And I had more range of movement and way less pain than I even imagined. Even when the nerve block wore off, I still didn't have much pain. Now I am numb right here. My scar goes from my let's see where it starts right here, and it goes straight up into my armpit, and then it goes straight back. So it's one continuous scar right there. And that whole area is completely numb. So, and that's to be expected also because all the nerves were cut right there. And so I have, and in this area, I have 2 drains. So I have these tubes that are super long in here. And so they go in here and they're in here. And I have these little bulb syringe. I'm gonna see if I can show you all this without showing you my skin. I'm not one of those women that's going to be flaunting her bare flat chest all over the place. But this is what I have. I have 2 of these. This is my lymph drain. So it drains from my lymph nodes. And then I have another one that drains from where my breast used to be. And I have to drain those 3 to 4 times a day and keep track of the amount of fluid that's coming out, because that will determine when I get my drains out. So post-surgery, if I talked to the doctor, I don't remember it, but she went out and spoke with my husband. And refresh here, my cancer is invasive ductal carcinoma. And it is so I had the tumor here, and then my entire breast was cancer. And then I had 3 positive lymph nodes that tested positive for cancer. And it's, It's estrogen positive, meaning that it's fed by my hormones. And it is HER2 negative, which is good because HER2 is like this protein. And because it's negative, I haven't really researched exactly what HER2 means. So I don't really worry about that one. And then, so the doctors, my oncologist and my surgeon were super impressed with how I responded to chemo. We all fully expected for me to have a complete response. They were going to take those lymph nodes that tested positive for cancer out, and then they were going to they're taking my entire breast, and then, obviously wherever the lump was, if there was any of the lump still left, then they were going to take that too. And it was right there in my breast tissue, so they were going to take it. So when the doctor came out to talk to my husband, they do something before called a sentinel node biopsy. And then if that is positive, I may have my details wrong, but if that's positive in some of your lymph nodes, then they do an auxiliary dissection. And so I had to do that the day before, and it's this dye that they inject in you, and that dye binds to any cancer cells that are in your body or in this area. And there was more cancer than we thought was essentially what happened there. So my lymph nodes are out of my armpit. And so there's like a little string of lymph nodes, and she just took it all. Some people have 10. You can have up to 40. Most people have under 20, but she took all of those. So they had to take way more than they anticipated, which meant that my incision was way more than we had wanted, because she was going to give me what's called an aesthetic flat closure. She was not able to do that. However, it still looks amazing from other pictures that I've seen. And so she knows that my scar is not what I wanted, but however, she had to ratchet. And this is where I'm sore. I'm really sore right here, because they had to take my arm and ratchet it way, way, way back, and go further back so she could get all of that on this side. And so that's where most of my pain is. And so we'll see what that says. They'll send all of that off to pathology. And today I should get my pathology report back. I have my appointment in about 2 hours. And that's one of those things that I'm a little nervous about. And we'll see what it says. And then whatever it says will determine the course of action. Obviously, radiation was always part of my treatment plan, because of the invasiveness of the cancer and the type of cancer breast cancer that I have. But all of this being taken out and being positive for cancer, or at least the dye showing that there were cancer cells in there, I definitely will be having radiation after all of this. I just hope I can lift my arm up by then. And but it will determine if I need to take more chemo. That's a possibility, which I knew that was a possibility in the beginning, that if I didn't have a complete response, or if they found more cancer at surgery, there's also a possibility of more surgery to go back in if they don't get clear margins. So I don't know what's going to be happening over the next little while for sure. I should find out today at my appointment. If I don't find out today, then because I'm meeting with the surgeon's nurse practitioner. But tomorrow I have an appointment with my oncologist, and I definitely will find out tomorrow. But the biggest thing that I'm hoping for today, more than, because the pathology report's kind of giving me a little bit of anxiety, is removing these tubes. I can bathe properly, trying to keep these drains and these tubes all like clean and stuff, and like out of the water is difficult. So there's been a lot of sponge baths and difficult bathing every few days. And then I've been wearing these. I bought these jackets online because you can't really put things over your head. Like I could probably put things over my head now, but it just zips up in the front. It's easy to put on. I have 2 of them, so I alternate washing them every couple of days. But they have pockets on the inside, so I can put my drains inside. So I think that is all about. Oh, and in the process of all of this, my husband has not been doing so well physically healthy. And so he has an appointment today right around the same time. So we're like, he's going to drop me off for my appointment and go to his appointment and then come back for my appointment. So we're trying to figure it all out because they're at the same time, but he needs to have this appointment because he's having an ultrasound to look at his gallbladder. So we'll see how that one turns out too, but we probably won't know much about his for a few days. So we'll see, and come back in just a little bit with hopefully either good news that my drains came out and maybe my pathology report. My back itches. All right, so I'm in different clothes because it's the next day. I didn't post my doctor's appointment yesterday because I spent several hours on the phone. And if you are friends with me on Facebook or follow us on Instagram, then you already know what I'm about to say. So I got to the doctor and they took my drains out. Yay! So I was actually able to take a shower, and which is, if you hear squeaking, it's this chair. It squeaks all the time. I think all of the chairs squeak. So sorry. But I was able to take a shower, and that was really nice to be able to fully bathe and not just cloth bathe, and it's been not super fun. Thankfully, I don't have much hair. Despite the fact that most of it's growing in, his hair holds on to odors. So, and I haven't been like sweating like totally crazy, so I don't stink horribly. So I guess that's a good thing to have surgery post chemo for those reasons, because it's a little bit easier to sponge bath than it is if you have a full head of hair and you still have to shave your legs and under your arms and all of that kind of stuff. So, but yeah, so I have my drains out. I have 2 nice holes inside or on left. Then I have just a little bit of fluid, a little pocket of fluid, right in here, which should just reabsorb back into my body. If not, they can aspirate it and it'll be okay. The big thing with my appointment is that I was super excited with my range of motion in my arm, thinking that I'm doing really great with how far I can get my arm up without pain. But apparently that's not good. I should be able to do this and this and this and all of that kind of stuff, and I can't. So I have something called cording, and she said there's a little bit of cording in my arm. And apparently that was mentioned after my surgery, that I might have to go to physical therapy to get my arm back to normal. And that's okay. But they're giving me a week of exercises to do. And it's basically just walking. It's like keeping my elbows straight and then walking my arm, like walking my fingers up the wall this way and then doing it this way. So I can get my range of motion back. But if I don't get it back within a week, then I have to go to physical therapy and they'll be able to get it back. And so there's that. I was super excited, about my range of motion. But then again, I've never had a breast removed and never had the surgery. So I didn't know what to expect at all when it came to that, and that's okay. But overall, I'm doing really well. They said I probably could have had my drains out on the 3rd day because of the amount of fluid that I didn't produce. I just produced a little bit, and some women, I guess, have them in for weeks because they produce a lot of fluid. I was asked if I ate really healthy and if I ate really good, and I said, yeah, I do. And I always have, or well, I shouldn't say I always have, only in maybe the past 8 years have I eaten really healthy. And, but apparently that makes a huge difference when it comes to all of your treatments. The actual treatments itself may be super rough because you're not used to those things, but recovering from your treatments and surgery and things like that, if you're used to eating healthy, that makes a huge difference in your recovery. So even if you do get, like, especially if you get breast cancer, because this is the only cancer I have experience with, so this is the type of cancer that I'm going to talk about. All cancers are different, but like if you have to have your breast removed, you're going to have drains put in you. If you have lymph nodes removed, you're going to have drains put in you. So whether you have a single or a double, you're going to have at least 1 to 2 drains per side. And the better you're eating and taking care of yourself, the quicker you're going to get those drains out. And trust me, you're going to want those drains out like ASAP. So I was really excited. It didn't hurt. It was a weird sensation. You could feel like this area is still very numb because all those nerves were cut. And it will be for a long time. So it's just a weird sensation with it coming out. It did not hurt at all. That's what I was afraid of, was pain. So I have a high pain tolerance, but the idea of pain gives me anxiety. So, but I also got my pathology report. Woo! So, the pathology is, I had some anxiety over potentially getting it just because they did find more cancer than they had expected to find. But happy to say that they removed it all. So by the non-medical world, pretty much, and everybody else, we used to use the term remission. There is no cure for cancer, but I'm basically cancer-free at this point. That's the easiest way to put it. And but they removed all of my lymph nodes in my armpit. There were 15 lymph nodes that they tested. 1 tested positive for cancer, which is good because I originally had 3 test positive for cancer. So that means chemo worked. My tumor itself shrunk significantly. It was still in there, but it shrunk, and which means that chemo worked on that. My breast tissue, they're basically diagnosing that as residual invasive ductal carcinoma, is what I'm gathering from my report. And that's kind of where I think I had more cancer than they fully expected to have. And so, but it's all removed. It's all gone. So the doctor, or the nurse practitioner that I saw, she said that when they do a mastectomy, like if they do a lumpectomy, then they use the term clear margins because they're still leaving breast tissue in you, and they want to make sure that they get clear margins and they get all of the cancer out. That's what that means. But they don't use that term specifically for a mastectomy, but essentially I have clear margins, meaning that I have no more cancer inside of me, which is super awesome. And then, so one of the cool things is the pathology report shows other things that they found, because there is another type of breast cancer that you can get that you can't find on a mammogram, and it's a lobular breast cancer, and so they do test for that. I do not have it, and then they test for a ductal carcinoma in situ, and I do not have that. So those are all good things to not have additional cancers, because that can happen sometimes, meaning that there are different cancers inside of the same breast. So But they did find some microcyst, some fibrosis, and some fibroadenomatoid changes. But that's no big deal. Those are nothing major at all. But again, everything's been removed. So there we go. And then because they took all of my lymph nodes, I'm at risk of lymphedema in this arm. And lymphedema is swelling of the arm. And you might see women or men too wearing compression sleeves on their arms that kind of go around and come to their hand, but they go all the way up here. That's because of lymphedema. And so they're going to send me to a specialist to help me try to figure out how to keep lymphedema away and how to take care of myself if I do get lymphedema. And she went over a couple of things that the specialist will tell me, like don't wear my purse on this side, which this is the side that I wear my purse on naturally. And so that will be like kind of the hardest thing. So I'm going to have to figure out something else to do because this is very unnatural for me to put my purse on. I may have to just suck it up or just not even wear a purse. And then, let's see what else. Oh yeah. So don't carry groceries with this arm. So don't do anything. Try not to have any sort of trauma to this arm. No blood pressure taken on that arm. No blood drawn on that arm. And then she was like, and then they tell you to try not to get try not to get bug bites on that arm. I'm like, are you freaking kidding me? I garden. Like, how the heck am I gonna not get bug bites on this arm? So if anybody has any recommendations for a really good, like natural bug repellent, like mosquito repellent, I have one that I use that I like. But if there's any more that you all have out there, recommend them because I would like them. And I don't want to use any of the like off brands or like that kind of stuff. I don't like them at all. But I would prefer something more natural. And so, but yeah, I mean, that's pretty much it. Cancer free. I'm very excited about it. I may not look very excited about it. But I'm very tired. And I think that plays a whole factor into the level of excitement. I'm still in the middle of treatment, and I will be treated for this for the next 5 to 10 years. And so that's my reality. I think for a lot of people who have a cancer diagnosis and they go through the treatments, because I've already been going through this for over 6 months at this point. And I still have radiation to do and things like that. And I'll have these scars that I carry with me for forever. And I might have some long-term problems. Currently, I'm still suffering with neuropathy in my feet and I can't feel my toes. It's not getting better. It's not easing up at all. It can take 6 months after you finish your chemo, the type of chemo that I was on, for that to go away. But mine is not easing up or getting better. So I'm a little concerned that may be something I have to struggle with for forever. I'm hoping not. But we'll see. And, but I still so I have that. I'm still growing out my hair. It's coming back. You can see it. It's fuzzy. I have eyebrow hair, like I've lost most of my eyebrows, but I'm calling this my eyebrow 5 o'clock shadow because all of this coloration right here is all little bitty eyebrow hairs all coming in at the same time, and they're very, very soft. And I've lost all of my eyelashes too, but I have all these teeny tiny eyelashes coming back all at the same time. I have very sparse hair coming back on my legs. I think most of my nose hair has come back. I don't know. And then, but I had enough hair on my legs to have to shave. I've shaved under this arm, but not this arm. I have hair on my fingers coming back. I have peach fuzz all coming back here. I told my husband if I start looking like I've got a mustache or a beard to let me know so I can figure that one out, how to take care of that, right? But, you know, so I'm still in the middle of everything. So while I'm super excited to not have cancer inside of me, I still look like a cancer patient. And I'm still dealing with side effects. I'm still tired. But this has been my life for the past 6 months, is cancer. And it's all that we have consumed as a family. So it may take a little while for us to start living like I don't have cancer. But we'll see. And I'm sure all cancer patients feel like this, living with cancer just kind of hanging in the background, knowing that at any moment it could come back. And that's my reality. And that's any cancer patient's reality, is that at any moment your cancer could come back. And I could still do everything I'm supposed to do to keep cancer from coming back, and it could still come back. So coming to terms with that reality is exhausting. It's daunting, but it's there. And I'll deal with it just like I've always dealt with things, and I'm okay with that. But so I may not quite fully share the excitement that everybody else does, and the relief and things like that. But it is really nice to know that I don't have cancer. Surgery was a success. My surgeon's a rock star. My scar is, like, I've seen a lot of scars in a lot of women's surgeries that they've had. And while I would prefer to be a little neater, I guess, you don't really know what your chest is going to look like when you've removed your breast. Mine concaves in just a little bit, and that's pretty normal. But my surgeon did a great job on the actual incision and sewing me back up. It's very, very tiny. When I go to radiation, it may get more red and irritated and things like that, but I'm really happy with the way that the incision looks. So, because all the bandages came off yesterday too, so that was really nice. But yeah, so I guess that's really it as far as I go. My husband had his ultrasound to look at his gallbladder, and hopefully today, maybe at least sometime this week, we'll have more of a direction on where we need to go for him. So thank you all for watching. We definitely plan on getting back to regular programming here soon, and not just cancer stuff. I'm really excited to show you all my garden, because I planted seeds and I did nothing else, and my garden is amazing in the fall, and it has survived the 2 frosts that we have had, the 2 hard killing frosts that we have had the past 2 nights here in the Memphis area, and it looks awesome. So thank you all for watching. Thank you all for praying for me. That has meant a lot to me to have people pray for me. And thank you all for sharing in the excitement that my cancer's gone. And keep in mind, I still have treatment left. So minimal side effects, that's what we would pray for, is minimal side effects on that. And thank you all, and I will see you hopefully sooner than later. Bye, guys.